And our health reporter, Lorie Johnson, has been closely following the coronavirus for weeks. She is here with us now for more. So, Lorie, there is a new case out of California, and a lot of people are talking about that right now. What's different about that case?
This is a patient with confirmed coronavirus in the Sacramento area, and the CDC believes that this is the first case in the United States of what they're calling community transmission. So this is a person who had not been to China and had not been in contact with anyone who was in China, and apparently hadn't been in contact with anyone who had the virus. Of course, officials are doing what they call contact tracing for all coronavirus patients, where they go back and kind of interview people that this patient has come in contact with, and they may find the source, but at this point, it's an unknown source. This patient is in hospital right now at University of California, Davis in Sacramento, and all the healthcare workers are also being tested for the coronavirus at this point.
Okay. And overall, scope-wise, what have we seen happen with the coronavirus this week? How quickly is it spreading?
Well, it's very interesting. The number of cases in China is really dropping off. We have seen a steady decline in new cases. The new low now, according to Chinese officials, is about 400 new cases. That compares to 2,000 new cases about this time last month. They say that it peaked about this time last month. Starbucks is now opening its coffee shops that it closed. 85% of the ones that it closed are now opening again because this appears to be dissipating in China. Meanwhile, more new cases outside of China. For example, in South Korea alone, more than 500 new cases. Right now, we're looking at 4,000 new cases outside of China and 61 deaths. That's a death rate of about 1.5 to 1.6%, which is lower than the death rate in China that we saw of 2%.
Now, who in the U.S. needs to be thinking about preparing just on an individual family basis for this potentially spreading at a greater rate in the U.S.?
Well, the good news about this, if you can find it, is that this does not seem to be attacking children. That we have looked at, the health officials have looked at reports from the first 72,000 coronavirus patients, and 0 children under the age of 9 died from it. Very few children under the age of 20 even contracted it. Most of the people who get it are over 50. Most of the people who die from it are over 70. About 80% of the people who contract this virus do not have very aggressive symptoms, mild symptoms, so mild that they don't need to be hospitalized. So we're really looking at older folks with pre-existing conditions, comorbidities, if you will, people who already have heart issues or lung issues. This is a respiratory situation. So symptoms include difficulty breathing and coughing and fever.
Okay, so that is very helpful information for everyone as we plan and think about this. Lorie Johnson, thanks for your time.